she's able to take a rest and let all of that input of our therapies, of all of the hands-on, have a chance to sink in. So that's why I love doing home calls, because they can just rest. But this is where I like to finish. So I use a claw-like grip. Carol, come on around. So this kind of thing looks good, like, you know, that kind of thing. But you can't withstand the rubbing as much as if you go like this and massage the underlying structures, those big flat muscles on the scalp. Then a new spot.
Okay.
Rub, rub, rub. Then a new spot. Meanwhile, the other hand is still working away under there. So, especially when you get around here, feel my fingers. Put your hands right on mine. Okay, feel how I pull up. So come with me. Don't do it yourself.
Okay.
Just come with me. Feel how I lift, move, lift, move, lift, move. So I'm moving along that occipital ridge. And then this hand, I always, come with me, I always have support on the front.
Right.
And that really is easy for her to relax when that's happening. Great. And if you hear the ice in the background, it's because we have your cold, icy foot bath coming up. Oh, there you go. Yeah, that's lovely. So you do, I'll show you on you. So you do this, and then new spot,
Okay.
and then new spot. Yeah, but you can make them big circles still, like a
Okay.
real grip.
Yeah.
And I find when I'm gripped opposing, then I can really do it. So instead of just worrying that I'm going to push you over, if I got them here,
Right.
that way I've got you in a
Right.
balanced kind of squeeze.
Right.
That's lovely. Now, does that seem to be my kind of pressure, Leela? Okay, good. Yay. The only thing we haven't done is the face. So we've got the scalp covered pretty good now. Okay, I'm going to show you how you can both. You keep working there, Carol.
Okay.
And what you would do, Slaney, is you would come up and be able to do this kind of thing. And just that facial massage. So that I use the thumbs here, and on the bottom of the face, I would use upward strokes. So we're doing boot camp face and scalp massage. And what you would do is kind of keep her pretty steady.
Yeah.
Yep, that's nice. Yep. And then with the thumbs, you can use. Yep. Oh, it's so great. You're doing it totally different than me, and it looks lovely. What I do is I tend to use the fingers on the bottom here, fingers, and thumbs on the top. And then even though I'm underneath there and here, like say she's in labor, she doesn't want to change this position.
No.
But we want to just make sure that we've got everything covered. You can still work the temporal area like this. So just try and slide a hand underneath, and you'll hit the temple there. Then this one here, yep, and do it at the same time. So it's right on the hairline. There, lovely. How's that? Isn't that neat? There needs to be more words for great.
Fabulous.
Do you have a second language besides English? Okay, you can use that now. Is it French?
No, it's
Spanish?
Farsi.
Farsi.
Oh.
Oh, my brain is too relaxed. I can't think of anything.
Okay, we're working on the right parts of the brain. We've got her totally Canadian. Yay. And then just see what adapts, Slaney. Like maybe it's fingertips that work better, you know, than my idea of thumbs. But, you know, working here in that temporal mandibular joint right here is good too. Try that.
On the jaw.
Yeah. There you go.
Just worried about pinching her
Perfect.
face.
Well, it's nice when you got the pillow there because it gives you an ease of movement to get. Yeah, that's
Is
good.
that one too much? I know that that one's super tender on
And then
me.
try up. There you go. And put that finger in. There you go. Perfect.
Does it
And
feel-
often, because it is tender on you, you can never do wrong on someone else. Because you have that built-in sensitivity. So it's nice to check in. Okay, guess where the super duper special is now? Lovely. It's ears. So I'm going to do the slice. So what I do is I put that finger in the front, this finger in the back. So it's like this kind of thing. But what I'm doing underneath here too, and you can just drop it. Let me stagger my way along. There we go. And like that. So we're not giving you the normal way to do a finishing face for our finale. We're doing the adaptive, so we really don't have to move her. We could just tilt her back like that, just like she was helping me out. And people will often do this, especially if they've been having a long labor. It's still amazing how much relaxation the whole body will experience by just doing the face. And I've never seen anyone include it, but we've got a contraction coming, so I'll show you what to do. Come around here, Chris. So we don't have to get any oil out at all. We just put a hand here, and it's starting to bite, and 2 hands on, and just breathe right into that place where I am, Leela. Yep, and as that contraction gets bigger, just make your breaths even bigger. Nice, big, huge breaths. And it's a counter press. That's very good. Good, 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 good. And as it's starting to come down the other side, just keep the pressure steady. Don't let it go.
Okay.
And let me know when it's gone, Leela. Another deep breath. Starting to go now. We're in the imaginary world.
Right.
Yes, it's gone. And you just then do a light massage. Just so that part of her body can't remember that it had a footprint on it. Okay, oh,
Right.
she's got another one coming. So try that, Carol. So one right on top of the other, but you need to be back with that stride. There you go. There you go. Don't pour it all on until we peak. Okay, we're just coming up the top. Okay, now, and I think you need just to be a little bit more, there you go, a little
Okay.
bit more center.
Okay.
Good, and now you're pushing. Now coach her like I'm doing.
Okay, Layla. Is it going away now? Okay. Breathe. Breathe into it. That's it. Breathe again. Breathe in. Good. Okay. Is it going now?
And then what do you do at the end, Carol?
Massage it a bit.
Yeah, and it's light.
Yeah.
So what you do is the light reflex stroking. That was good coaching.
Okay.
And Slaney, you want to step right in here? We got another contraction coming. So there's 3 ways to do it. One on top like this, going that way. Then you can go this way, and then you can go that way. And you can wedge in like this.
Right. Okay.
And counter pressure it that way. There's something about the counter pressure of the uterine pressure on the inside and this, and especially as the baby starts moving on down, where you can really feel that it's not up there anymore, like it was in initial first stage labor.
Okay.
We've got all sorts of things happening as the baby's
That's
moving
right,
down.
yeah.
And so you start moving this. Sometimes they'll go, oh my God, and it's more the tailbone. So instead of being like right on the sacrum like this, I'll show you, Chris. So I might be there, right on the sacrum. Let me show you with, here we go. Like, so that's the gluteal cleft here, and the sacrum starts right above it.
Mm-hmm.
And so I can have my hand this way, or this way, or that way.
Right.
This way is like a little downward pressure, right?
Mm-hmm.
So these are usually the ways I do it. I don't usually do that,
No.
but I have, you know.
Right.
I find that I get more power like this. So then as the baby's coming down, she'll go, oh. And so I will hook around so I'm like right like that
Okay.
and press. But there's something just about how we exert on the outside helps what's happening on the
Right.
inside.
Right.
Okay, so Slaney, do you want to take it? Here we go. Contraction coming up. And yeah. So then around here, Chris, you want to record. If you keep your eyes open, Leela, then Carol's going to be right here. And I'll do the first one and then I'll give it to you. Okay, so here we go. Just keep looking right at me. Keep a focus where the sensation is and breathe right into it. That's good. Breathe right into the very center of that sensation. Nice work, nice work. Here it comes, stronger and stronger. I want deeper breath. And really focus. And just let everything let go. That's good. Let your jaw drop, let your shoulder drop. And then just keep pressing there, Slaney. Good work. Perfect. We're at the top now. Just breathe right into it. Stay with me. Then we're going to come down the other side. Good focus with me. Just get everything you need from my clients. Yep, and breathe. Yeah, nice work. We're just about at the end. Take another deep breath. That's good. And then just let yourself go way, way down. We got a 3-minute massage break coming up. We'll massage you, and you can just breathe and relax till we get to the next one. So you don't have to be quite as wordy, Carol.
Right.
But we're going to try that again. Okay, I usually like to touch them,
Yeah.
hold their hand like this. That way I can tell if she starts getting a death grip on me like that,
Yeah.
I can go just let go. You can just drop your fingers, just let go of my hand. That's about the only let go concept thing I do is let go of my hand.
Right.
Or other than that. But a lot of people go, squeeze me, squeeze me. They don't have a hand left by the time that baby arrives, right?
Oh, okay.
And there is a mind over matter that you can let everything drop and just let that uterus do its work. If you have everything tightening up, that doesn't get a chance to be the focal of all of her attention and
Right,
energy.
right.
So we want to let everything drop. In between the contractions, we're going to work those muscles so they're refreshed again. Okay? So there you go. You can talk her along. Remember, it's an imaginary
Okay.
practice
Look me
session.
in the eyes, Liz. Take a deep breath.
And keep everything still. That's it.
Okay.
Tendency is to rub them
Yeah.
or this kind of thing. You're okay, honey, you're okay. Drives them nuts. Just keep it steady.
Okay. Deep breath. That's good, Layla. Let it out. That's it. Let your elbows drop. Let your shoulder drop. Good. Good.
Okay, it's right at the bite now. It's right
I'm
at the
sorry,
bite.
I have to
Keep
kiss
it.
her.
That was a mother-in-law break. It's one of those mistakes you can't reprimand them for. We'll take it from the top again. Okay, here we go. And traction coming on. Make sure you keep your eyes on your mother-in-law. There you go. She's yours,
Deep
Carol.
breath. That's it. Let it go. That's it, Layla. Take another one right into where the pain is.
Okay, cut.
Oh,
So,
no
no,
P?
that's okay. We
Oh.
just don't use the P word. So it's great
Okay.
that you used it.
Okay.
Because I'm a documentary person. I want to go, use the P word so I can tell you not to use the P word.
Okay.
But what I do is I use the S word. Breathe right into that sensation.
Okay.
And also let it get big. It's like signing up for a traffic accident. Like, you want that to be as uncomfortable as possible because it's squeezing the
Right.
baby out. So
Right.
we don't want to resist it, but it's
No.
like, how the heck do we get into it? But this counter pressure
Yeah.
and your voice
Yeah.
and looking at her and keep her on a short tether, it works. So I just get rid of the P word
Okay.
or the D word, discomfort,
Yeah.
and I just go, let the sensation get big.
Okay. Sensation.
I even talk about let it bite, give that baby a good squeeze.
Okay.
And when we focus on squeezing the baby, it all makes sense,
Okay.
We've got a little bit of proactive happening then.
Yeah.
Okay, here we go. Take 3.
Okay. Look at me, Layla. Okay. Deep breath. That's it. Let it go. Okay. Breathe into the sensation. That's good.
And we're right at the top.
You're at the top now. Okay. Deep breath. Let it bite.
We're coming down the other side.
Okay. Good, Layla. Nice deep breaths. That's it.
Try saying stay with me.
Stay with me, Layla.
Yeah.
Stay with me.
And it's going. And it's gone.
It's
What do you do
hard
at
to
the gone?
do.
No, you stay with her. That was
Yeah.
good.
Yeah.
That was great.
Yeah.
You always get it in there. And use your name. That was
Yeah.
great. You're doing a good job, Leela. You can never
Yeah.
say enough. You're doing a
Yeah.
good job, Leela.
I'm just getting emotional.
Nice work,
thinking
team. Put her there, Carol.
I'm going to be a grandma to twins.
Well, that was the mother-in-law special, everybody. You saw it here in Nelson, British Columbia. I'd say keep your hands on. Leela is in good hands.
Absolutely. Thank you so much.
And we'll just do that light stroking. Okay, boys. She's all yours. And then we'll just tuck her in. And that's really good, the way you did those light strokes after the compression. That was really great, Selena. So we're doing just a little quickie quiz. And you can help me out here. Okay, so Carol, what are some of the things that you would do when she's having a contraction?
When she's having a
Yeah,
contraction?
show me.
Okay, I would probably put my hand inside her hand like this,
Mhm.
keep my hand still,
Okay,
and I would get her to concentrate on my eyes,
good.
and I would help breathe with her
Mhm.
and breathe into the sensation.
Mhm.
Yeah.
Good one.
Thank you.
Come on back here and show me what you do.
So as her contraction begins, it would probably be a little higher at the back. I would take my hand and I would just apply pressure.
Wonderful posture, Carol. She went right into it.
Yeah,
And
brilliant.
then as the contractions get lower, I would come down and press and hold.
That's so good. Ah, sorry. Oh.
Like so.
Can we ask your mother-in-law to write the textbook?
Yeah.
Good work. That's lovely, lovely posture too. Thank you.
Yeah.
That was amazing.
Slaney, what would we do with puffy hands and feet?
Well, ringing
Mm-hmm.
and pressure, fingertip pressure
Yeah.
quite a bit.
And what would be the principle in the extremities for getting the swelling down out at the end?
Blood and all pressure goes up
Up.
towards the heart.
You got it. And then as far as the extremity itself goes, where and why do we start where we do?
We start at the main joints, so the hip and the shoulder,
Mm-hmm.
to kind of start the blood flow towards the extremities.
Mhm.
You really open up that area, loosen everything up, and then you
Yep.
start the pressure continuing up towards the
Yep.
heart, and then you get to the next joints
Exactly.
and relax them and start loosening them up, the blood flowing that way.
And what's a good image to think of?
Ringing?
Uncorking the bottle.
Uncorking
If
the
you
bottle.
think you
The
got to
bottle,
take the cork
okay.
or the lid off the bottle before you can get anything out of it, that's the idea in the shoulders and the hip. Okay, what if you had a whole team? Okay, Carol, we've got Can arrived, helicopter just flew in, then we've got the best friend's mothers
Yeah.
on the job, and we haven't even shown up then. What are you going to do? You got an extra 3 people in the room,
Right.
and Christine, the boss, has not arrived.
I would probably put Ken up front with her hand and doing the eye-to-eye contact.
Check.
And probably Gilda and I would take turns with the shoulder and the hips and the light massage.
Okay,
and
she's getting contraction.
then I would probably take over with this part because I
Mhm.
know what I'm doing right now.
Where would you put Gilda?
Gilda could probably work on her head. Be
Okay,
close-
and we don't want her to move, right?
No,
So when there's a contraction, what do?
everything,
Nothing.
nothing.
Okay, it's just holding.
Just
So
holding.
with Gilda, I'd suggest you've got there, get Gilda here. Something like that,
Okay.
and just
Her legs
everybody
open.
breathing.
Okay,
you know?
yeah.
That kind of thing, if she's on her side.
Yeah.
If she's on her back, then what we're doing, we're actually putting pressure underneath her and lifting up into her.
Okay.
And you can, remember the way we did that underneath the
yeah,
table?
yeah.
Great. Okay, team, way to go. Yes, welcome to the Kootenays.
Thanks.